It's a request to everybody that we open up the links by 9:15 so that we can start the lecture by 9:30. What is happening is people think that the lecture is going to start at 9:30, considering people keep joining till 10:15. So it's a request that everybody please join by 9:15 so we can begin at least by 9:30 and finish off on time. What happens is, because everybody keeps joining late and then they keep asking, recording ये वो, इससे अच्छा बेटर है 9:30 के पहले आप ज्वाइन कर ले, so we can begin by 9:30. अवधूत स्टार्ट कर दो.
Yeah. So good evening, everyone. Last time we had discussed about Shodhan Nasya mainly. So today we will be discussing more about Shaman Nasya, and of course if you have any queries about Shodhan Nasya, then also you can post right now. After the use,
अवधूत आवाज खूप ब्रेक होता है तुझं.
आवाज ब्रेक
for you or your patients or relatives in last 1 week. If you have come across any queries or any problems in Shodhan Nasya, then you can post here. Or mainly our today's discussion would be on Shaman Nasya.
स्नेह स्टार्ट कर रहे हैं हमरा. आई थिंक अवधूत मीटिंग लेट्स प्लीज.
Sorry for the interruption. What Avdu sir was saying that we have till now covered the Shodhan Nasya. Moreover, we have not talked about Shaman Nasya till date. If any one of you have any doubts practically in Shodhan Nasya, you can post the questions in chat box or in the group. We can address those questions also. But today's focus will be on Shaman Nasya.
Clear with the Shodhan Nasya. Those who have got any query, any doubt.
Okay. If anyone has queries, practical queries after using Gudshunti Nasya or Pradhaman Nasya in daily practice or on oneself, you may post question in chat box or in the group so we can address that right now. Otherwise, we may shift slightly towards Shaman Nasya today and see what we can do or how we can use Shaman Nasya in practice.
Snail, how
Yes.
many of doctors have tried Shodhan and Pradhaman Nasya?
How many have tried voting to sir 23 of the participants.
I'm not asking about participants. I'm asking about how many of them have actually started the Shodhan Nasya.
Yes, sir, 23 participants say they have started using Nasya practice. They voted for
Very nice. Very nice. So they must be successful in many cases, and maybe some queries in some of the patients, or maybe having some complications, or still the principle may not be clear in their mind. They can ask the question. First, you master Shodhan Nasya.
So if anyone has any queries, practical queries after using Shodhan Nasya, Gurshunti Nasya, Pradhaman Nasya in clinical practice? Have you come across any queries, doubts, confusion? You may post in the group or right now in the chat box. So we will address those queries.
Sneha, I think you start with the questions that we have already framed, and then I think that will solve a lot of questions. It will answer a lot of their questions. Probably they have it in mind, but they cannot frame the question.
They can talk in any language. Language of Nasya is important than the native language.
One query was there, sir, that we use Shodhan Nasya, Gurshunti Nasya specifically. Generally, we put 16 drops, sometimes 20 drops to check. So, does this quantity of drops apply to Shaman Nasya also? So, do we put 16, 20 drops of Shaman Nasya also?
No, we cannot put so many drops of Shaman Nasya. It's not necessary that first day we put Shodhan Nasya and second day or third day we may put Shaman Nasya. Not necessary. First, make sure that by putting Shodhan Nasya, the Samavastha gets vanished completely. May take 1 day, may take 2 days, may take 5 days, may take 10 days, may take 15 days, any number of days. Go on putting some Shodhan Nasya. Now, I will clarify here one more thing, that by putting Shodhan Nasya, if you are not successful in getting the response to reach up to the eyebrows or the forehead or the hairline, then put Shunti Pradhaman Nasya, make the patient lie down for about 2 minutes, and after about 10 minutes you put Gur Shunti Nasya, both are Shodhan Nasya. Then probably the response would be faster and better. Instead of increasing the number of Shodhan Nasya or increasing the amount of Shunti Pradhaman Nasya, it is better to combine both one after the other in a specific interval of time. Then the response would be better before switching over to Shaman Nasya. First, we have to master our Shodhan Nasya. Practically every patient requires Shodhan Nasya. Practically all the patients requires, except few exceptions. Other day, somebody was asking whether this can be used in trauma. As in one of my lecture, I had mentioned that Shodhan Nasya is used for Shodhan. What do you mean by Shodhan? That Nasya Dravya can be used as an analgesic, anti-inflammatory, antipyretic, and anti-allergic agent. So any pain, we have to use analgesic Dravya, and best is Shodhan Nasya. So if you put a dozen patients Shodhan Nasya in a traumatic cases or any painful condition, you will come to know exactly the role of Shodhan Nasya in a traumatic condition. It is because we have not tried, so we face so many questions. Hello? Hello?
Yes, sir.
Yeah, just don't jump over from Shodhan Nasya to Shaman Nasya. It's not that fast. But first get the result with Shodhan Nasya. Wait for some time, wait for a few days, and then you will be able to assess the condition of the patient, in the severity of the condition, in the severity of the different modalities of the presentation, and then you may switch over to Shaman Nasya. I'll give you one example. Today's patient, 14 years old girl, suffered from migraine since last 3 years. This is just to make you understand. Menstrual cycle was quite active. Since 3 years she is having menstrual cycle, which is heavy, painful, lot of leukorrhea, lot of mood swings, and menorrhagia. Predominantly it was Vata and Pitta dominated situation. Here we cannot start Shodhan Nasya to begin with. You have to calm down the patient, make the patient feel comfortable, relaxed. Patient was hyperactive. So here we gave Shaman Nasya. And in Shaman Nasya I used Panchagavya Nasya, just 6 drops in each nostril. Waited for about 10 minutes and I gave simultaneously Aschyotan. In 10 minutes time patient felt much better. After explaining to the father, I gave now Shodhan Nasya. Shaman Nasya has got little limitation in penetration. But giving Shodhan Nasya after Shaman Nasya, it propels the Shaman Nasya which was given earlier. Again after 10 minutes patient felt absolute remission. Almost 9 out of 10 patient got the relief for the first time in last 3 years of time. So here I have combined Shaman Nasya, first Shaman Nasya and then Shodhan Nasya. This you will realize in your practice. Vice versa is also true. Sometimes you have to give first Shodhan Nasya followed by Shaman Nasya depending on the condition. There is no hard and fast rule that this is the number of days you have to put Shodhan Nasya or number of days you have to put Shaman Nasya. So it will be varying from patient to patient, condition to condition. Same patient at different time frame, we may have to change the selection of the Nasya. So initially for first few days you have to call the patient and put the Nasya by yourself on the patient. And after you feel that now this things are getting stabilized, then you can ask the patient to put the Nasya at home. And again after putting the Nasya at home, ask the patient to come to your clinic either once in 5 days, 1 week, maybe 10 days, maybe 15 days, depending on the case. After about 15 days of time, you will feel confident and patient's relative also would feel confident. Make sure patient doesn't put the Nasya on his own. Somebody else has to put the Nasya. So don't allow the patient to put on his own. One wouldn't know where exactly the Nasya is going. So the practice only will make you feel comfortable and confidence. Number of drops of Shaman Nasya, it cannot exceed 8 drops or 10 drops. Don't never exceed 10 drops to begin with in a practice. If it doesn't reach on first day, don't worry. Put it on second day, third day, fourth day, fifth day, because here there is no time limit. When to put, where to put, how to put, because it is Sadhya Nasya, doesn't require any preparation. So you can put it every day, but don't exceed the dose. So also in Shodhan Nasya, don't exceed 10 drops. When you are beginning your practice with Nasya, don't exceed 10 drops. You may continue second day, third day, fourth day. Slowly it will start reaching the forehead. Not necessary it should reach the forehead on day 1 or day 2. Some patient may take 10-15 days also. But then you can combine both the Shodhan Nasya, Sunti Pradhaman and Gud Sunti Nasya. the results will be faster. But for that also you need practice. Next question.
Okay.
You might want to add something. Yes.
नहीं सर, मेरी सेकंड क्वेश्चन नहीं है. मैंने फर्स्ट क्वेश्चन नहीं समझा है, वो this कीधु ત્યારે. I was copying from the chat box and by that time you said, so I didn't hear the question.
The chat box, there is a question in chat box by Dr. Sunaina. Is it possible that after Shodhan Nasya, that is GS Nasya, Gurshunti Nasya, someone catches infection?
I have not seen any such kind of problem in my practice of Nasya, and only thing you have to remember that the Nasya bottles should be cleaned properly in hot water, or rather you boil it, glass bottle you boil it in a water, and after putting off the flame you can put the cap of the bottle in the hot water, clean it up properly. Similarly, you for sieving you take the clean cloth, cotton cloth, so the chances of infections are meager, rather there are no chances of infection. And suppose there is already some discharge in the nose, then ask the patient to clean the nose first and before putting the Nasya. I think after taking these precautions and of course all other parameters, there are no chances of having infection. Your ginger powder also should be fresh. Almost up to 3 months you can use ginger powder after grinding.
Sir, like Shodhan Nasya, should Shaman and Bruhan Nasya should also reach the top of the head?
Like Shodhan Nasya is acting like a scavenger in the head. So you will literally feel it is getting cleared off. Your sinuses, your other tracts, your cavernous sinus, transverse sinus, from the head, you will experience that it is getting cleared off. This may not happen true with Shaman Nasya or Bruhan Nasya. It's not necessary Shaman Nasya and Bruhan Nasya should reach the top of the head. Not necessary. But within few drops, patient feels very comfortable, very calm and cool and composed. Patient would get relaxation. In last so many months or so many years, patient might not have felt the sense of relaxation the way he is feeling after putting this Shodhan and Shaman Nasya. Shodhan and Bruhan Nasya. Shaman and Bruhan Nasya, depending on the case.
Okay, sir, in all the cases we consider that the patients are coming to us in Samavastha, so we generally start with Shodhan Nasya, be it Shunti Pradhamana or Guru Shunti Nasya. So how do we decide when to switch from Shunti Pradhaman to Guru Shunti? It's Shodhan Nasya also, how do we decide from Shunti Pradhaman to Guru Shunti, and from Guru Shunti to Shunti Ghrut? So from the Pradhaman Nasya to the Shodhan Nasya, the regular Shodhan Nasya, and from Shodhan Nasya to the Shodhan Shaman Nasya. How do we decide that?
First thing, practically all the patients are in some problem or the other when they enter your clinic. So first thing, as a dictum, you have to use Shodhan Nasya. Be careful if the patient seems to be in a Niramavastha of any disease, Niramavastha, but still I would prefer to put Shodhan Nasya because we don't know that Niramavastha has been created by giving some allopathic medicines or any other medicines. So the actual symptoms might get blocked, might get, you know, um, hidden problems. So consider Niramavastha as a Samavastha and put Shodhan Nasya first. If patient still feels more comfortable, more lightness in case of so-called Niramavastha, then you presume it was Samavastha and not Niramavastha. By chance, suppose actually you have put Shodhan Nasya in Niramavastha, there won't be much harm by putting Shodhan Nasya. At least it will give you direction. It will give you diagnostic test. So then you are pretty sure that you are dealing exactly with with a Niramavastha. So first patient always, first time when it comes to you, put Shodhan Nasya. Now selection of Sunti Pradhaman or good Sunti Nasya. Suppose there is any discharge from the nose or watering from the nose or watering from the eyes or sneezing or recurrent headache or any change, with any change in the weather, patient gets allergic rhinitis, pharyngitis, laryngitis, always put first Sunti Pradhaman Nasya. Once patient gets cleared of his problems in the sinuses or in the nose, in the eye, in the head, in the throat, then you can give good Sunti Nasya. Patient again feels still more comfort level. Now after that also, if he says I'm feeling completely normal, then you may switch over to Shaman Nasya. Right? Now here there are so many conditions where we can discuss different combination of Nasya used on the same patient on the same day. Variety of conditions, like as I told you last time also, that menorrhagia, menometrorrhagia, dysmenorrhea, that dys represents pain, pain represents vat, and menorrhagia, that means excessive bleeding, that is pitta. So excessive vat and excessive pitta, maybe rather you presume it is uh, uh, samavastha of pitta and vata. So you put Shodhan Nasya, immediately the menorrhagia and dysmenorrhea reduces, as against what we would otherwise feel that patient requires Shaman or Brahman Nasya. By putting Shodhan Nasya, there is a result, and then you can switch over to Shaman or Brahman Nasya depending on the case. Right? So Shodhan Nasya gives you direction. Shodhan Nasya gives you diagnosis of Samavastha and Niramavastha. Is it clear?
Yes, sir. Sir, it is well understood that in first visit we use Shodhan Nasya, but when consecutive consultation comes, and if you have switched patient from Shodhan Nasya to Shaman Nasya, still we have seen you putting Shodhan Nasya in every consecutive visit for patient. You put GS for every patient. Why is that so? If patient is in Shaman Nasya stage, still you are checking with GS. What is the purpose of that?
Very good question, very delicate question, brother. So when patient comes to you for the first time, you have put Shodhan Nasya and confirmed that patient is having Samavastha. And after putting Shodhan Nasya, patient feels comfortable, probably is reaching Niramavastha. So after about 10 days or 15 days when patient comes second time, during that period, whatever patient's condition was, the Niramavastha doesn't remain Niram for 10 days or 15 days all throughout, for some more time in future. So always check by putting Shodhan Nasya, even if we feel it is the stage for using Shaman Nasya. Put Shodhan Nasya, nothing wrong. Now patient feels little more irritation in the nose or in the head, or maybe little warmth in the head, top of the head also. Then you may feel that this is now it was a pure Niram Avastha, and you have confirmed there is a Niram Avastha by using GS. So immediately you put Shaman Nasya. Within no time patient would feel comfortable again. So now you're sure that patient is now in 100%, so 100% Niramavastha. So then the patient's journey would start from Shaman Nasya. Second time or third time or fourth time after using Shodhan Nasya, and then if necessary Shaman Nasya. After 2-3 different spaces, you will come to know exactly the patient belongs to Niramavastha and start putting Shaman and then Brohan Chikitsa, Brohan Nasya, right?
Okay.
At the same time, you keep recording all parameters like BP, then oxygen saturation and pulse rate. I had seen one patient with pulse 130 at rest, 130 at rest. It was difficult for me to decide whether to give Shodhan Nasya or Shaman Nasya or maybe Brohan Nasya. But patients, after assessing the patient's condition, only heart rate or pulse rate was 130. I gave Shodhan Nasya. Patient felt better. Next 10 days, the pulse rate came down from 130 to about 115. Now I was little confident in giving Shodhan Nasya again. Next time, third time when she came, the 115 heart rate had come down to 198 or in that range. Fourth or fifth time when patient came using the same Shodhan Nasya, patient's heart rate and pulse rate came absolutely normal, which otherwise we would have missed the chance by putting either Shaman Nasya or Brohan Nasya. If you are in dilemma, then you put Shodhan Nasya, and just after about some time, 10, 15 minutes, 20 minutes, put Shaman Nasya. Easiest Shaman Nasya is Good Sinti Grita Nasya or Panchagavya Nasya. Or ask the patient to follow the same regime at home after confirming the after confirming Niramavastha, right? And ask the patient to call you up as and when there is a problem. So you are always there to help patient day in and day out.
Sir, is it possible that we suspect that the patient is having Samavastha in general examination
Most of the patients
and still
come in Samavastha. Most of the patients.
while
I will tell
putting
you two, three examples. I'll tell.
yes, the Nasya reaches in
How
two
to? It is not
three
audible
drops.
properly. It's not audible clearly. Your question.
So I'll
Can
repeat
you
his
repeat?
question.
Please
Yeah, I'll
repeat the
repeat his
question.
question. He is asking that is it possible we consider that the patient is in Samavastha, but when we put the Gud Shunti Nasya, it reaches in 2 or 3 drops. Is it the question, Avdut? Can you chat in the time box or try Mahendra again to speak?
No, I didn't
Sir,
get
but
the question.
okay, sir, till the time he comes, I'm asking a question which I have a doubt. I think it's not even in the list that we have. There are patients who have Kosthagata Samata, but when we look clinically, when we examine, the patient has Samata. But when we put the nasal drops, they reach only in 2 or 3 drops. And the patient like literally says, 2 drop में तो ऊपर पहुंच गया, अभी इसके ज़्यादा मत डालो. So how do we interpret this thing?
By putting Shodhan Nasya, 2 drops reaches the top of the head in a patient
Yes.
where there is a Koshtagat Samavastha.
Yes.
Right?
Yes.
Now here, what kind of Samavastha patient had in a coast? If it was a Pitta, Samapitta or Samavad, within no time the Shodhan Nasya will reach the top of the head. But if the Koshtagat Samata belongs to Kapha or Kapha and Vata, it will take more number of drops and multiple times of Nasya, Chodan Nasya, where it will hardly reach the top of the head. So Koshtagat Sam Avastha or Koshtagat Vat Avastha or Koshtagat Vat and Pitta Avastha, which is Sam Avastha. And within no time, patient will feel the sense of relaxation. So that confirms that there is Sam Avastha. Now here, by putting 2 or 3 drops, the drops reaches the top of the head. That means patient's Koshta has already got Niram Avastha of Pitta and Vat. Niram Avastha of Pitta and Vat. That confirms.
But the patient gets very sticky stools, extremely sticky stools.
Ha. So it is the Grahani. That's the problem. Grahani. Now here, if 2 drops reaches the top of the head, so you can consider this could be Pitta's Grahani or Vata's Grahani, or combination, right? But that again, Sodan Nasya, just 2 or 3 drops reaches the top of the head, you can come to know that this is a Niram Avastha of Pitta and Vat and not Kaph, where even endoscopy or other tests will not give you that much clear-cut diagnosis what Nasya can give you.
Okay. Avadut?
I think Avadut no आवाज નથી સંભળાતો.
Avadut, can you try again? Next question line है.
So there is another question on Shodan Nasya in the chat box by Dr. Sajjala, that multiple times when we use Shodan Nasya, is there any effect on menstrual cycle? Will menstrual cycle reduce?
Always analyze and differentiate Sam Avastha from Niram Avastha. Then what dose is involved? In PCOD, PCOS, it is a less menstrual or oligomenorrhea. While in dysmenorrhea, menometrorrhagia and menorrhagia, there is excessive pitta and kapha. Even excessive pitta and kapha, as I told you earlier, presume that it to be Sam Avastha of pitta and Vat, give Sodan Avastha, Sodan Nasya. If patient feels better in next 1 cycle or 2 cycles, you will come to know that it was Sam Avastha of Pitta and Vat. Once patient feels comfortable, pain and excessive bleeding reduces, that confirms that there was a Sam Avastha of Pitta and Vat. So once patient comes under control, then you can switch over to Shaman or Devchand Gala. In PCOD and PCOS, you can really activate the pituitary gland, which is secreting the hormones, hypothalamo pituitary ovarian axis. Similarly, that holds good true even for TSH, high level of TSH, hypothyroidism. Same principle holds good. Is that clear?
Okay.
Sir, may I ask?
Yes, Sajjala.
हाँ सर, मुझे यहाँ पे एक पूछना है. मेरे ही अभी एक पेशेंट है तो उनको फाइब्रॉइड है. ओके, तो मैंने उनको शोधन नस्य तक डाला था. तो अब शोधन नस्य के बाद में उनका साइकिल 24-25 डेज का था, वो 21 डेज हो गया. यही सेम चीज मैंने दूसरे 2 पेशेंट्स में भी देखी कि उनका साइकिल रिड्यूस हो गया. तो ऐसा होता है क्या?
Yes, everything is possible. It all depends on what dosas are involved in that patient, particular patient. If it was Sam Avastha and you have given Sodan Nasya and periods have reduced from normal 28-day cycle to 21-day cycle, that means you are giving Sodan Nasya to a patient where it was already Niram Avastha and you have increased the Niram Avastha, so it has reduced so much. So also too, when you give Sodan Nasya and the patient's cycle prolongs, Same dosas are used, and Shodhan and Saman, you have to keep gazing. So it is possible to reduce the number of days of the cycle, or where patient is having 20 or 21 days cycle, you can increase it to normal 28-day cycle by using the Nasyas, either Shodhan Nasya or Shaman Nasya. Same thing holds good true even with hypertension. Samavastha, Niramavastha. Is that clear, Sajjala?
Yes, sir. Thank you.
Yeah.
Sir, how to decide which Shaman Nasya to use after we have crossed the stage of Shodhan? How do we decide what to use?
After confirming the patient is in Niramavastha, purely Niramavastha, then try Shodhan Nasya before going to Brahan Nasya. Now Shodhan Nasya, you can use either Gud Sunti Grita Nasya or Panchagavya Nasya. This is what we use it in practice. If patient feels comfortable, take it for few days and keep checking the patient's condition periodically. When patient doesn't have any problem, then to prevent the recurrence of the same problem, you can use Brahan Nasya. It acts as a Rasayan Chikitsa. So Brahan Nasya will fix the problem completely forever.
So, after Gud Shunti, we switch to GGS, means Shunti Grit.
Gud Sunti Grita
Or
Nasya
Panchagavya.
or Panchagavya Nasya. That is good enough. You get enough time for Shaman Nasya to be put. And after again some period, when patient feels completely fit, so-called fit, then you can switch over to Brahan Nasya to prevent the recurrence of the problem. That will act like Rasayan Chikitsa. Brahan Nasya acts like Rasayan Chikitsa, and patient can get relief from the problem completely forever. Rather, time will come, once condition is absolutely in Niram Avastha, it is said that you put 2 drops of Gogrut Nasya in each nostrils every night before sleeping for a normal person. It will keep all your 5 senses intact and with full strength. Just 2 drops of Gogrut Nasya, Brahan Nasya in each nostril before going to bed. Once you achieve the stage of Nirama. That is actually a take-home message. Put 2 drops of Gogrut Nasya in each nostril every single night. It will help you, for your hair also, for your all the senses like eyes, ears, nose, tongue, skin, and your mind. And you get good sleep at night. That is take-home message by putting 2 drops of Gogrut Nasya in each nostril.
Sir, what changes do we expect after putting Shaman Nasya? Like after putting Shodhan Nasya, patient feels lightness, freshness. So after putting Shaman Nasya, what are the signs or symptoms the patient may tell us?
Patient will feel the bliss, lightness, freshness, and relaxation patient would feel after putting Shodhan Nasya. But after putting Shaman Nasya, patient would be in bliss. He says he is absolutely in heaven. That's the change. That's the response you will get from each patient.
Right.
Of course, there are variety of presentation, but in nutshell, patient will give you lot of credit, and in such a short period of time, patient would feel that bliss. And Nasya will bring many more patients, by mouth-to-mouth publicity.
Yes, sir.
Is that right?
Okay. Yes, sir. Yes.
Next question.
The next question is from Dr. Anju. What about Nasya in diabetic patients? Will the same protocol help to see the difference?
You have to find out the pathology, samprapti of diabetes, type 1 diabetes, type 2 diabetes. We first consider type 1 diabetes. The cause of type 1 diabetes is what? It is supposed to be autoimmune disease. So there is inflammatory process in the pancreas. Wherever there is inflammation in the body, you have to use anti-inflammatory drug. And Sodhan Nasya is anti-inflammatory agent. Put Sodhan Nasya even in type 1 diabetes, type 2 diabetes also. You will feel gradual changes coming up. I have an 8-year-old son, patient, whose both the parents are doctors. And son has type 1 diabetes since last 5 years. He is at the age of 8 years now. Since 5 years, he is having type 1 diabetes. I started with the Sodhan Nasya. Mind you well, both the parents are doctors. You can consider their apprehension, about their child. What will happen? After putting the Nasya every day, type 1 diabetes where insulin is indicated, patient could be weaned off the insulin injections at least since last 1 month, and yet his sugar levels remains around the same level what it used to be when he was using insulin injection, just by giving Sodhan Nasya and with simultaneously some other medicines for diabetes. Similarly, in type 2 diabetes, Sodhan and Shaman. Probably patient may not require Brahman Nasya for fairly long time. You can play with Sodhan and Shaman Nasya, and keep an eye on sugar levels. It will act as an anti-inflammatory agent in a condition where there is inflammatory condition in the body.
Okay. Sir, once we shift to Shaman Nasya, there are certain changes that are expected. But what if the patient feels heavy after putting the Shaman Nasya?
If patient feels heavy after putting Shaman Nasya or maybe after putting Brahman Nasya, either there is Ati Yoga of Sodhan Nasya or Shaman Nasya. Very easy. When patient complains of heaviness in the head or heaviness in the body or swelling on the face or swelling in the body, it is Ati Yoga of Shaman Nasya or Brahman Nasya. So what's the answer? Put Sodhan Nasya. Everything will get cleared off. There won't be any complication for a long time. Within a day or two, patient will be cleared of all his problems. And ask the patient to come down to Sodhan Nasya. There is one hint also in selection. There is one, I'll give you hint in selecting the case. When patient complains of hypersomnia, excessive sleep, even daytime also, we may feel there is pituitary thyroid axis defective or excessive TSH in hypothyroidism, where patient complains of lethargy, tiredness, moodless, and excessive sleep. These are the cases where you have to straight away use Sodhan Nasya. And every single day patient will feel the change, positive change in the sleep pattern. right? Second hint, while examining the patient, as I told you earlier, if you feel your patient's head feels heavier in checking the flexibility of the neck, straight away it is Shodhan Nasya because it is Samavastha. Whether it is Kapha Samavastha, Pitta Samavastha, Vata Samavastha, or combination of dosas Samavastha. Straight away put Shodhan Nasya and patient will immediately in 5 minutes or 10 minutes time, patient, you will feel the head which was heavier to lift now has become lighter to lift. This you will come to know in so many patients. Straight away indication is Shodhan Nasya. You cannot go wrong. Is that clear?
The next question is in the chat box from Dr. Pallavi. Can we use Shaman Nasya, Gofrut Nasya in pregnant lady?
Yeah. Again, in pregnant lady, initially one may start with a Shodhan Nasya for a short period. And after that, if everything, all parameters are good, you can use Shaman Nasya. I would not advocate Brown Nasya to begin with. Shodhan or Shaman, Shodhan or Shaman. If there are indications like any other preeclampsia or something like that, or edema of the legs, or some problem in the womb, fetal distress, use Shodhan Nasya. But it depends from case to case and condition to condition, and gestational period also. In patient after delivery, if the breastfeed is not sufficient, you can enhance the breastfeeding, breast milk production by giving Shodhan Nasya. I had one lady who had mastitis, multiple nodules in the breast, one of the breast, and it was painful. It was going on since last about a year or so. Mammography did confirm mastitis. I gave Shodhan Nasya, and within 10 minutes, the pain and the swelling reduced, not gone completely, but reduced to such an extent, patient felt comfortable by giving Shodhan Nasya in the clinic and seeing the results in 10 minutes. These are all breast and the pregnancy related problems. Is that clear?
Shall I?
Sir, Ashish sir wants to ask something.
Yes. Yes.
No, I just wanted to share experience which sir has advised long back. A lady having absolutely no breastfeed, and in one of our Guru Purnima meeting, I discussed with sir, and after starting only Gurushanti, she came out like just now sir said. In 3-4 cases I have seen it.
The feed increased. What you said, Ashish?
Sir, earlier feed was not there at all. There was no, no breast milk was coming, and then they have tried everything, and then they have actually left. She was started baby on a top feed, and in one of the Guru Purnima meeting, I discussed out with you, and then you suggested you start with simply Gudashunti to begin with Pradhaman and then Gudashunti. And within I think first 5 or 6 days she called up and said now slowly breast milk is coming, and then later on it became smooth. So I remember this, and I have seen it in
this confirms. Sorry, Ashish, that there was a Samavastha.
Yeah, yes, it was Samavastha.
Yeah. So Samavastha means straight away Shodhan Nasya and you see the results within no time. Good, Ashish. Good trial. Put these cases on group, Ashish.
Thank you. It's because of all your guidance.
Put the cases on group. It will enlighten so many other doctors.
Yes.
Sir, after Shodhanasya, we say ask the patient when the burning has stopped, we ask him to get up. So how do we go about the Shaman Nasya or Bruhan Nasya? How much time should he lie down?
First of all, it is very clear that we are using this as a Satya Nasya.
Right.
There are definite matras for giving Satya Nasya. Right? In matra, Madhyam matra and Rasva matra. As far as possible, don't try to exceed Rasva matra. Patient may not feel like, so then Nasya patient feels, burning here or little heaviness in the head for a few minutes. But in Shaman Nasya and Bruhan Nasya, patient may not feel this kind of presentation, symptoms. But then you should not exceed Rasva matra. Whether you choose Shaman Nasya or Bruhan Nasya, most probably use the Madhyam matra. And if with Madhyam matra patient doesn't give any positive response, go on repeating Madhyam matra second day, third day, fourth day, because we are we are giving only Satya Nasya. So by giving Satya Nasya every single day, there is no problem. Okay. One day it will get cleared up. Otherwise, we may have to go for proper Nasya Chikitsa where pre-treatment, post Pradhan Karma and Paschat Karma is to be observed. That may take pretty long time, very tedious, time consuming and expensive. Okay. Here by continuous Shaman Nasya for a few more days and patient will get the result. Don't expect the result to come on very first day or very second day. Yes. But it is still faster than giving regular Nasya. This is very fast, yes, very quick and less expensive, much less expensive and faster convincing to the patient. Doctor patient response would be much better.
Sir, for how much time should we ask the patient to lie down after Shaman Nasya?
About 2 to 3 minutes.
2 to 3 minutes. Okay.
Patients should not feel heaviness in Shaman Nasya. That is only criteria. They should not feel heaviness. There shouldn't be any excessive watering from the eyes. Or maybe little heaviness in the eardrums. Or something comes out in the throat. So it is little excessive proportion of Nasya. So you stick to Madhyam matra, 4 to 6 drops, not more than that. You can repeat every day, nothing wrong. Don't put like 10, 15, 20, 30, 40, 50 drops of Shaman or Bruhan Nasya. You may create complication in a patient. Don't exceed the Madhyam matra. I prefer Madhyam matra. Sometimes in some cases I have given little more than Rasva matra in a particular selected case, and he got the result very fast. Then what you should be doing, if you exceed Rasva matra or maybe Rasva matra, after some time you give little Shodhan Nasya, so it will balance. Hello, Avadut? Even if you put Rasva matra or little more than Rasva matra in particular case, and after about 10-15 minutes you give Shodhan Nasya to balance the situation. Are you getting my point? So patient leaves your clinic very comfortable and calm and cool state of mind.
Yes, sir.
Next question.
Yes. What time should we put Shaman or Bruhan Nasya? What time of the day? Morning, afternoon, night? What time should we put it?
You can put it even after midnight also. You can put it in the daytime also. You can put it in the office. You can put it in the school. You can put it in the college. During COVID, we used to give Sunti Pradhaman anytime, anywhere, anybody. It can prevent the flourishing of the viruses or the bacteria in the nose and nasal cavity and oral cavity. So Sodhan Nasya can be given without any restrictions.
Sir, what about Shaman and Bruhan Nasya?
Yeah, Shaman and Bruhan, only you have to confirm that patient is in totally Niramavastha. And after Niramavastha, give Shaman Nasya for some time. Then you will feel, the patient feels the bliss. Then you can switch over to Bruhan Nasya. And Bruhan Nasya you can give sparingly, not regularly.
Timing, sir. Morning, afternoon, evening, post
Again, I will repeat. We are giving Sadhya Nasya. So when you come to the stage where the patient is in Niramavastha and you have completed this Shaman Nasya and you have come down to Bruhan Nasya, then you can continue with Bruhan Nasya, just Hin Matra, just 2 drops in each nostril Bruhan Nasya. You can put every day. Every day. It has been mentioned in the text also. 2 drops. At the most, if there are a lot of nasal hair inside, you can put 4 drops. 2 will get entangled in the hair only. Hardly 1 or 2 will go upstairs. So no problem. And after about few days of giving Bruhan Nasya, in between you recheck by putting Sodhan Nasya, whether everything is going on smoothly or not, whether the patient is still in a Niram Avastha. Then you can continue with the Bruhan Nasya. What else?
Yes. So what should we do if after putting Shaman Nasya, if the patient feels that he has nasal block? So immediately we should put Shodhan Nasya in that case?
You have to find out why there is a block after giving Shaman Nasya or Bruhan Nasya. Either you have put the Shaman or you have chosen Shaman and Bruhan Nasya little early, then it is required to be put. So put Shodhan Nasya. It will get cleared off.
Immediately.
Maybe after 5 minutes or so. Maybe you have selected the time little early, then it is required. That means patient had not reached the Niram Avastha completely, and you have put the Shaman Nasya or Bruhan Nasya. So come back to Shodhan Nasya. Wherever there is problem, come back to Shodhan Nasya. And you will come to know immediately that you have made a blunder, rather you have not selected the timings regularly, properly. So come down to Shodhan Nasya and you will come to know this is the right time. Still patient requires Shodhan Nasya. Patient is in Samavastha, not in Niramavastha. Once patient reaches Niramavastha, select the number of days and Shaman Nasya and then Bruhan Nasya. We may make mistakes, there is no problem, but ultimately we should give comfort level to the patient. I have learnt just because of the practice. And you are so young, everybody, so you will grasp the things very fast than what I have done earlier.
But it is already. Yes, sir. You're saying, sir.
So, Snail?
Yes, sir. તમે કઈ કહેતા હતા. You continue.
Because it's such a fantastic procedure where you will not only earn money, you will earn patience. And one good patient which has been treated properly with Nasya, he will bring many more patients to your clinic. Only by Nasya. It is said that if patient comes with a urinary colic, you give one injection of Baralgan and patient gets relief immediately. He will be so happy, he will go and bring another patient. But if you get a patient of chronic constipation, no matter what you do, it will take such a long time to treat chronic constipation. He may not be satisfied with your treatment. He may not be satisfied with any other doctor also. I'm talking about allopathic treatment. Ayurvedic treatment, you all are very expert, by giving Virechana or Basti. But Nasya also gives excellent results. Yes,
already 10:40 now. We continue. There are 2 more questions in the chat box. Many remaining in the list. Should we continue or should we take in the next session?
It all depends on all the doctors, whether it's going to be little more and more challenging, it's more and more fascinating. Keep practicing Nasya. Keep practicing Nasya. You may write, Ram, 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 Ram in, whole book you will feel Nasya, 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 Shodhan, Nasya, Nasya, Nasya. You will be really a good doctor. Enjoy this. Fascinating. You will get compliments by practicing Nasya. No fear. And this is rather not tapped properly in our Ayurvedic faculty. I think so. And you get this chance to practice Nasya. Sadhya Nasya. Those who are practicing Panchkarma would get extra benefit by using Shodhan Nasya and Sadhya Nasya. So everybody will be benefited. What else? By practicing Nasya, many more questions will come, many more complications, many more queries, many more doubts will come. And if you want to get them cleared off, you can continue next time, same Nasya. Depends on everybody's interest. It could be boring for somebody who is not interested or who has not practiced. But those who are practicing will get positive results. Yes, Snail.
Sir, as you said, there is a comment in the comment box that one of the doctor got a new patient referral as she started using Shodhan Nasya. After starting off, she started using Nasya and she is getting new patient reference.
How many new patients you got after using Nasya?
That we have to ask her, sir. It is from Dr. Anju that she got a new patient just because it is from Dr. Anju that she got a new patient just because she started using the Shodhan Nasya now.
Anju, you will get many more new patients after using Nasya. You see the thing, that day is coming very fast to you. You will not get time to practice more and more and more. So, Biju?
Sir, we end the session.
Okay, as you said.
So there are a lot of questions from the list that we had prepared. And I think throughout the, and there were 2 more questions in the chat box, 2 or 3, which were not answered. So we have added those questions and put it in the list. If everybody of you agrees for another session for queries regarding Nasya, then we can take another session next Friday regarding queries for Nasya. So the more they practice, the more queries we will have.
Hema, sorry to interrupt you. Good evening, sir. This is Dr. Rupali Patil. Sir, and that patient, about that patient Swara Parker, 13 years old girl who came to. Actually, I sent that patient. She's my friend's daughter. So I don't know, sir. In means is this much young girl, 13 years old only, she's having headache almost every day. So I really don't know what is the cause and how you look at that patient, sir. What is your interpretation about her?
I'll tell you, because this is common question, that's why I'm answering in this session. She has a migrainous headache since last, I think, 2-3 years, right? Almost every day with a varying intensity. Now, if it is migraine, young child doesn't get migrainous headache. But suppose there is a migrainous headache, then it is supposed to be vitiated pitta and kapha. Vitiated pitta and vata, right? I would consider that as a samavasa pitta and vata. This patient, this child, 13 years old, has also got vitiated vata and pitta, where she has got menorrhagia, dysmenorrhea, leukorrhea. Again, vata and pitta. Her nature is also vata and pitta, very aggressive, short-tempered, right? Cannot control her mood. During her menstrual cycle also, she would flare up. Again, that is vata and pitta. So that confirms by 3-4 different areas, confirms that this is pitta and vata. So I gave Shaman Nasya first. First I gave Shaman Nasya. Patient felt much lighter and better. And Ashyotan. I asked the patient to wait outside. Then after about 10 minutes, I called the patient again. Then I put Sodhan Nasya. She said after Sodhan Nasya she felt still more better, much better. I asked her what is the grade of pain when she came. It was 10 on 10. Before she left, it was 1 on 10. So 9 out of 10 she was feeling much better on very first day after so many, I mean such a young age, and 2-3 years of time she is feeling the positive change. She calmed down, she got relaxed. She doesn't sleep well at night. She sleeps around 3 o'clock midnight, 3 o'clock early morning, and gets up for the school around 6 o'clock. So then she has to compensate her sleep by sleeping in the afternoon. So that's not the correct cycle of sleep. So that also confirms that it is because of pitta and vata. So give Shaman Nasya, simple. And she felt the change immediately. The father was happy, the child was happy.
The parents were worried about her studies, sir. Means she is now in 9th standard, and she is very introvert girl, and her mother is very dominating. So what I felt after taking his history, because they came to my place for Ganpati festival, they are very close friends. So I thought it is not only somatic. I thought it is psychosomatic. Some psychic factor
We have
was also
included
there.
we have included a psychic problem. So did she talk to you today, or the father talk to you today after coming to me? Talk to her tomorrow and let me know tomorrow.
Okay, sir. Because I'll call him tomorrow. Yeah.
He is much better today.
Because he told me that he got today's appointment, and I'll talk to him tomorrow. Yeah.
Okay. Don't worry, she'll be fine.
Okay.
She will come out with a bright colors even in exams.
Okay. Yeah.
Because you have to balance vata, pitta and kapha. That's all, simple. Whether it is somatic level or psychic level.
Thank you so much, sir. And thanks a lot for all these sessions also.
No, sir. Yes, Ima?
Yes. I'm sorry if I sound like a monitor, but यहाँ पे क्या होता है, why I am asking everybody to come on time, because see हम सब बहुत young हैं sir is pretty aged. He doesn't realize in his out of his enthusiasm na he'll keep talking for 2 more hours. But then we have to think about him also that he gets tired after the class because he's the person who's doing the majority of the work. He's just managing. So इसके लिए request करती हूँ कि please come early so that we can begin early and we can end early. And it would be nice if you post your questions throughout the week. If you start, posing questions when the lecture begins, what happens for us to moderate the session and pick up questions and ask sir becomes a little bit difficult. If it is throughout the week, then we know, okay, what we can compile and ask together to sir. So it's a request to everybody, if all of you start sharing your queries, your questions throughout the week and your experiences too. We are not taking too many questions on tongue and all that right now, but just do the experience sharing about the tongue also. We'll start taking those questions later once this whole topic gets covered. There is another thing that you all can do is take the tongue photo before the Shodhan Nasya and take the tongue photo post the Shodhan Nasya and start seeing the changes. You can inspire your patients and see how immediate the difference is there before the Shodhan Nasya and after the Shodhan Nasya. मतलब वो होता है ना कि नितिन कोचर सर्स फेवरेट डायलॉग हा सूर्य आणि हा जयद्रथ वैसा मतलब ये दिखा दिया आपको ये टंग ऐसा और ये टंग ऐसा so then patient cannot deny that. So that's the effect of Nasya. There are some patients who would say सब कुछ करेगा नहीं हमको कुछ फर्क नहीं पड़ा. The samta is so much that they're not able to even register anything that is changing. So at least the tongue picture will show them, okay, see this. Another thing that you can start noticing is do the abdominal examination before the Nasya and also once the patient is lying down for say 5 minutes till the burning goes off. Once the burning goes off, again examine the abdomen of the patient. You will see huge changes in each and every quadrant. So you start noticing that. So you start training your hands. Like how we check the nadi, start training your hands for the abdominal examination. You will see difference, like how you see difference on the tongue, you will see the difference immediately on the abdomen also. Initially, don't try to judge kya hua. Just start registering. Just register what has happened in each quadrant, what has moved. Because there is definitely movement of the vayu. There is definitely some movement of the pitta. Cough takes a while to move, but you start noticing these things very nicely. So you can explain these things also to the patient. Sir, બીજું કઈ કેવું હોય તો આ તો મેં just
any suggestion from Ashish?
Sir, Ashish sir નથી actually. Already.
We can put an end to this now.